Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is October 6th. Wisconsin just surpassed 8,000 deaths due to COVID-19. Hospital beds and intensive care units are reaching peak capacities, while the state only inches forward in vaccinations. All this while some are considering a vaccine booster and a new pill that could be taken upon receiving a positive COVID test. To help us understand what's current with COVID, we turn to the medical director of infection control at UW Health and infectious disease specialist at the UW School of Medicine and Public Health, Dr. Nasya Safdar. Thank you so much for joining us.
Thank you.
So the state's data is showing cases and hospitalizations are either kind of holding steady or still increasing depending on where you are in the area of the state. Have we kind of hit this peak of the Delta wave, or are we still going to see the worst of it as we approach more of the fall and winter months?
You know, it's obviously hard to completely predict, but I think what's happening is that in areas that have high levels of vaccination, you're not seeing quite as sharp a peak as you would otherwise expect. And so there is this sort of stuttering effect where you are either holding steady or you're seeing more hospitalizations and then levels off. Of course, it would be great to have fewer hospitalizations, and no one county or region exists in a vacuum. So here, for instance, we provide care to patients all over the state and beyond. And so our hospitalization rates may go up regardless of what local vaccination rates look like.
And the 7-day average of those hospitalized is over 1,000, and more than 300 are in the ICU. The Wisconsin Hospital Association data is showing more than 40% of hospitals are at their peak capacity. Would you consider this even more of a crisis than what we saw last year? And are non-COVID patients with critical care needs being likewise impacted?
I think it depends what sort of capabilities exist within the particular health system. I don't think we're quite there where we were last year. I mean, last year, there was the need to postpone elective procedures and surgeries in order to repurpose those rooms for patients with COVID. That isn't happening at the moment everywhere, although some health systems may have had to do it because of their capability. I think the concern that it may happen, though, exists. I mean, it's not just the physical space that's the issue, but also the workforce. You know, as infections are in the community, healthcare workers also tend to come down with them. And then given that there's a need for highly trained people to take care of patients with COVID, that really limits what one is able to do.
And with school having been in session now for at least a month, not only are we in person for the university, but also for K through 12. Are we seeing more pediatric cases, considering that Delta is considered a worse variant than what we saw last year?
I think overall, pediatric cases have increased compared to in the earlier days of the pandemic. I think there's a big spectrum in how severe the illness is, ranging all the way from having no symptoms to landing in the hospital. And there's a syndrome of massive inflammation that can happen after one has recovered from COVID that is more common in children, that does land some of them in the ICU. Having said that, I think that the mitigating measures that places should take, such as schools, for instance, with masking, testing, monitoring, and all those do appear to be effective in containing the number of cases. You know, it won't eradicate COVID. I think we've all come to the realization that eradication is not a practical option, but learning to live with it and managing it does seem to be the next goal.
Are you worried about the long COVID symptoms in children?
I think we have to understand those a lot better, not just in children, but also in adults. I think there's a big spectrum of symptoms. Some of them have to do with how severe your initial COVID illness was. And that may mean things like persistent shortness of breath or fatigue and so on that will improve over time. And others don't seem to be related with the initial severity of illness. And those are things like feeling very foggy or having memory issues. And those are concerning. And I mean, all symptoms are concerning, but these in particular, because we can't always predict them and we don't have good therapeutics against them. So I think our main goal for COVID should still very much be upstream prevention.
A new federal Department of Health and Human Services report estimates that vaccinations prevented around 5,500 infections and 700 deaths in the elderly in Wisconsin. Is it frustrating to be a part of this life-saving research, putting so much energy into it, and yet there are still so many choosing not to get vaccinated at this point?
Well, I think one does wish that more people would embrace what's in front of us as an effective way to prevent COVID. Having said that, I mean, a life saved is a life saved. So we'll take everything that we can get. But given that capacity is not so much an issue in this country with vaccines and the supply is there, it would be great if the demand also went up.
And now many are considering whether or not to get a booster, as the efficacy of the initial vaccine series wanes over time, anywhere between 6 and 8 months. Would you recommend that those who can get a booster should?
Yeah, absolutely. If you're in the group that's eligible for a booster, you should. And I suspect that many people who have taken the 2 doses are in the group that, they're believers in vaccine effectiveness and the data, and so they will take a booster. I think for those that were reluctant to take the vaccine to begin with, I doubt that the availability of booster will affect their decision making.
And even now, a new pill from Merck is seeking federal approval. It's designed to be taken upon a positive COVID diagnosis, and supposedly it will help prevent more severe symptoms. Do you see this and other solutions that are not vaccines being promising in the fight towards combating COVID?
Oh, absolutely. The vaccines are great, but we still don't have one for pediatrics. So we need that as the first order of priority. Having said that, there will still be some people who will have breakthrough infections or who won't be able to take the vaccine. Or who won't be able to take the booster. So to manage the cases that we do get, we need a really good outpatient regimen. Right now, we don't really have much. We have the monoclonal antibodies. They require one to go somewhere to get it. It's an IV infusion. It needs monitoring. So it gets very complicated. And with complexity comes barriers to access. But if there was an oral pill that you could take in the safety of your home without having to go out with symptoms and potentially expose other people to your illness, I think that could be, if this is found to be effective, really change how we manage COVID cases.
And to be clear, we've heard these stories about people who are in the hospital sick with COVID, and they're asking if they can now get the vaccine, and it's too late to get the vaccine. And this pill wouldn't be for something like that. It's also too late once the severe symptoms have already set in. Is that correct?
That is correct. This is really designed to prevent hospitalization. And once that has happened, then this would be futile to use at that point. There are other medications for patients with COVID who get hospitalized, but nothing trumps the effectiveness of the vaccine.
Considering this pill now, and other ways in which we've come to start fighting this virus in many different ways, are there parts of your research that, or others' research that you've seen that you're really excited about and on the horizon of, as another facet, another angle towards the future of fighting COVID?
Well, I think in the vaccine development realm, there's some potentially promising developments about nasal vaccines, which would make it even easier for people to get it. I think looking at the effectiveness of these in individuals who are immunocompromised and older, where the conventional doses might not take as well, I think all of these are promising lines of inquiry. There's over 300 different candidates as far as therapeutic agents in various stages of clinical trials for COVID. So there's no shortage of research that is underway to identify what those are, but we do have to have them go through the rigorous process of evaluation for effectiveness and safety before we jump the gun. And that's true for this Merck product as well. The only data we've seen so far is in the form of a press release, so it does need to be independently evaluated.
Beginning in 2022, you will transition to a new role as the Associate Dean of Clinical Trials at the UW School of Medicine and Public Health. However, in your current work as an infectious disease specialist, you've already been involved in clinical trials, particularly related to COVID-19. What have those looked like?
Well, so one of the trials, for instance, that's still underway is using a topical combination of things. It's intranasal povidone iodine, which you apply with a swab. And then it's rinsing with oral chlorhexidine. These are both antiseptics. They're available over the counter and are pretty well tolerated. but using this in a program to see whether they can reduce COVID infections. So that's one of the COVID-related trials that is potentially low cost and high impact if it is found to work.
You do a lot of media availability and you do a lot of research simultaneously. Do you see how to talk about this research, how to almost market this to people to make sure they're getting the most accurate information? Do you see that as being a part of the future of research and science and developing new ways to combat viruses like this?
Oh, absolutely. I mean, honestly, research means nothing if it's conducted in a silo and it doesn't get applied. And the people that will apply it and will take it forward is the public. So being able to effectively communicate what research is doing, how it's helping the human condition and human health is really critical to our job.
And so how will your work going forward as you're transitioning to this new role, how will it expand, and how important are things like clinical trials important to the continued fight against SARS-CoV-2, COVID-19, and has this all really accelerated since the urgency of this pandemic?
Well, I think the SARS-CoV-2 pandemic did highlight the gaps that we have in current clinical trial infrastructure. And it also highlighted the miracles that can happen when people collaborate to rapidly bring something to evaluation, to authorization, and then to the public. And the outcomes, and you can see the real world outcomes around us. Mortality from COVID, even independent of the vaccine, has came down largely because of these new developments. And any new development that you can think of is the product of years of research. You know, we often don't see that, all the back end work, but thinking about things and even independent of infectious diseases, when you think about breast cancer, for instance, if you go into the physician's office and you're diagnosed with breast cancer and you're offered treatment options, all of those are the results of decades of research. So being able to benefit from that, I think, is really important. And the only way to do that really is to actively participate in trials. So my role here will be to lead and develop and accelerate a program of clinical trials research. So it will be beyond my own work, for instance, in infectious diseases, but really will be to support the participation of as many patients as possible in clinical trials program and to be able to offer them that opportunity. Too often that opportunity is limited, and we want to change that.
And you do want your work to expand beyond COVID, but do you also see COVID clinical trials expanding as you're doing this future work?
Absolutely. I think for as long as the pandemic is a threat, which, you know, for the foreseeable future, it seems to be, we'll want to absolutely offer to our patients any clinical trials that are happening and then lead some locally as well that will be national large trials. For instance, the NIH has a number of products that they're testing. And these are such trials that they can be offered to anybody in the nation. So you don't even have to travel. You can just enroll in the study and agree to take a particular candidate intervention. So it's those kinds of things that we want to really facilitate. A lot of what a clinical trials leadership program does is collapsing barriers to clinical trial participation. And my role will hopefully alleviate some of those barriers.
You said a few moments ago that you don't think that eradication of this virus is going to happen. Did you always think that, or is it just recently that that kind of seems like the reality? And if it's not eradication, what is the management?
I don't know that I always thought that. I think we were all hopeful in the beginning, especially when these highly effective vaccines came out, that this might be the end. I think we believed that there would be a little bit of smoldering of the virus. It would just make its way into respiratory virus season like others do, and it would cease to be the kind of threat that it still is. And now I think what we're learning is that the way this particular virus mutates and the strains that emerge, some of them can be more threatening than others, and Delta is one of them, and who knows what the next one will be. So to be able to find a way to manage this threat, which means using all the tools at our disposal, and that includes vaccines, it includes oral, readily available, easy to take, inexpensive therapeutics, and it means providing the best possible care to those who are hospitalized of COVID, regardless of other things. So I think all of that will need to be brought to bear. And of course, research will aid in the development and the identification of new and existing therapeutics. So we may find something that will completely attenuate SARS-CoV-2, but until that happens, I think we have to continue using everything we can at our disposal.
All right, Dr. Nasia Safdar, as always, thank you so much for your work and for joining us today.
Thank you.
For more from Here and Now in PBS Wisconsin, you can visit pbswisconsin.org, and thank you so much for joining us on Noon Wednesday.